Hello and welcome to Seven Sentinels. This is Grandmaster Class, and I'm Peter Simon with you. Today we are conducting speaking sessions, and we have Hafsa Fatima from the United Kingdom, but originally from Hyderabad, India. Yes, you can start, Hafsa.
Okay. Good morning.
Good morning, nurse.
My name is Hafsa Fatima. I'm a registered nurse. Could you please tell me what brings you in here?
Yeah, the doctor has asked me to meet you. This is something connected with the insulin injections, nurse.
Mm-hmm. Mm-hmm. Okay. So you're here to discuss about the insulin injection. All right. Thank you for approaching me. And can you please tell me how do you feel about commencing insulin injections?
Yeah. Um, I am not very much comfortable because I have been managing for the last many days.
Mm-hmm.
Okay. So I am not very much comfortable.
All right. It's not a problem. Um, Anyhow, you're gonna start with the insulin injection because it's been advised with your from your doctor because the oral medication you were taking on is not working on you anymore. However, there is nothing to be worried about. Can you please tell me what exactly is your anxiety related to? Whether it is related to injecting process or fear of pain or needles?
Yeah, I am a
Mm-hmm.
little bit scared of it.
Mm-hmm.
Yeah, I from my childhood I am a little bit scared of that, and I don't
Uh,
prefer that.
yeah, okay. I understand you completely. However, it's easy to manage injections, so no need to worry. With the clear instructions, you are going to manage it effortlessly and with the easier practice. Because it's important for you to start insulin injection as your current blood glucose level is on a higher side and the current regimen you are following is not working on you. So, and how, aside from this, it's a insulin injection is has some advantages like faster absorption into the bloodstream and doesn't broke down in stomach and more effective than oral medication. Did you get my point?
Okay.
Mm-hmm.
Yeah, I understand. Now, if there is no other option, you tell me what is the procedure? How am I going to do with all these things?
Yeah. Yeah, let me explain you the process. The first and foremost thing what you need to do is washing your hand and drying your hands thoroughly, and you can pinch your skin, the side you are gonna inject the needle, and insert the needle for about 40 to 90 degrees angle, and then leave after administering the injection, leave that place for 5 to 10 seconds. Do not rub it, please, because it's gonna absorb simultaneously according to time. So just leave that aside. And one the most crucial thing I want to tell you is you can rotate the injection site. Um, like there are first many like number of sites for you to inject, like thighs, your arms, and stomach. So you can rotate those sides accordingly to prevent the formation of lumps and risk of less insulin absorption. Because once you inject your inject you the medication continuously on the one side, it forms a lump or a kind of hard mass. So it's better for you to rotate that side, as well as the insulin absorption can be good.
And that's
Am
fine.
I clear
And
to you? Yeah.
yeah, that's fine. Absolutely fine. And what about the used needles and syringes and the sharps, all these things? What am I supposed to do with them? Am I supposed to throw in the other garbage or? waste materials?
Yeah,
Or
for
is there
that
any
you
specific way to dispose them of?
absolutely you're right. There is a suitable containers for it. You can get it from the pharmacy, and or you can get by the prescription as well. So you can take care of the used needles in a proper and sorry. Yeah, it is important to discard the same needles in a suitable condition with a proper cane and handling. So there will be a disposal container. You can get it from the pharmacy. And apart from that, you can refrigerate the unopened insulin in a refrigerator, of course. And not please do not expose that to the sunlight under high temperature. And please check expiry dates before taking that medication.
Yeah, that's very
Uh,
nice, nurse.
yeah.
Thank you very much. And what are the side effects and after effects or ongoing problems based on because of this medication?
Well, I would say you to take the insulin injection just prior to 5 to 10 minutes before eating anything, because it's suddenly gonna uh, take you to the hypoglycemia. That means the low blood glucose level in the blood. So yeah, low blood glucose level. So that's gonna be a complication. So I would suggest you to eat after 5 to 10 minutes to prevent that. And if you ever find any complications for like I mentioned the earlier about the formation of lumps or any wound infection, so you can approach us anytime you feel.
Yeah,
That's
definitely.
it.
Thank you very much. I will take your suggestion seriously and I'll
Yeah, thank you
follow
so
all
much.
the points. But for
Yeah,
now, for today's, yeah,
lastly, I would like to obtain the willingness of yours to commence self administration of insulin.
yes, uh, yes, definitely. I will follow all those things. So you can train me now. Thank you very much.
Right. You're welcome. Thank you for listening to me.
Yeah. So, so that's the speaking session. And then, yes, Hafsa Fatima, you are doing well, but I don't know what caused you to panic here and there. I don't know. So you have to keep a watch on these sounds because that's not positive. That's not a positive sign. You have to take care of these things especially. And then, um, first, let us think about your grammar. Grammar is fine. They don't have much problem, but you are using this American style of presentation. That's I'm gonna. I think you have used that once. Don't use this type of you know, versions. Definitely, that's not going to be good. So avoid those things, and then otherwise everything is fine. Then next one, vocabulary. Vocabulary is good, a little better, but definitely not excellent. So you have to focus on these areas. And then next, pronunciation. Yeah, your pronunciation is fine. I don't find any problem with your pronunciation. But of course, there is a difference. That is a native speaker's pronunciation and Indian pronunciation, of course. But still, it is a lot better. You are in the middle, not towards Indian pronunciation, not to British pronunciation, but you're in the moderate gauge, we can say. So that's not a problem at all. That's you can improve still further. And then next you have fluency. Yes, fluency. I already told you this pauses and breaks, sounds, unnecessary sounds. You have to take a caution about these things, and you can focus on those things, and you can definitely improve in those areas. Next one is accuracy. Accuracy, I told you there are three types of components. First one is the grammatical component, accuracy with regard to grammatical component. Second one is accuracy regarding to vocabulary component. And third one is accuracy regarding pronunciation aspect. So grammatical, you're doing very fine, but the quality you can enhance. Okay, you can enhance quality by merging two sentences into one complex or compound or simple sentence. Um, unless and until you are compliant with insulin injections, your condition cannot be improved. Okay, so despite taking medication, diet, and exercise, despite being medication compliant, taking regular dietary regimen, and doing physical exercises, the condition cannot be controlled as it was in the past. So, despite now, this can you can say, though you take a medic, yeah, I agree with you totally. I agree with your concerns. But in the past, the situation was okay. But now, though you take a medication, though you are medically compliant with medication, follow the dietary regimen, and involve in regular physical exercises, the condition cannot be managed. So now this you can use it, but I agree with you. You tell that you are compliant with medication, but managing the condition is not possible. Okay, it's not possible. So alternative methods have to be implemented. Therefore, alternative methods have to be implemented. So you used with a despite, you use these two sentences, join the two sentences using although, you join the two sentences using but. So despite makes it a complex, simple sentence, although makes it a complex sentence, but makes it a compound sentence. So this is how you can improve your quality. Is that clear, Hafsa Fatima? Now unmute. Yes, you can
Yes.
speak now.
So I have a question here.
Yes,
In
please.
speaking session,
Hmm.
can we use passive voice?
Definitely. Who told you not? Speaking and writing, you have to use passive voice. I have been telling for a long time. I have been telling you.
Okay,
Because
so
because if you use passive voice, it is professional.
mhm.
Otherwise, it is
Yeah,
as if you
yes,
are boasting yourself. I will give you instructions. I will tell you. I am what you are
that is
great.
why I'm giving importance to myself in here.
Yeah,
That's
you should
I
not give
felt that
importance
way.
here. You should give the importance to the patient, and most importantly, every sentence you have to give. Medications should be taken regularly. You should not say you should take it's like an order.
Yeah,
If you say you should take medications regularly, it is like an order. You understand?
yes,
Medication should be taken regularly. Medication compliance is extremely important. So, did you talk about those things which you are talking? Then a dietary regimen should be followed. Participation in exercises on a daily basis is advised. Finish.
yeah,
So give importance to that particular point in that particular sentence. Everywhere you is not important. It
mm,
makes curd into buttermilk, watery buttermilk without any taste and flavor. Correct?
yeah,
You cannot enjoy. Is that clear? Anything else? Come on. Now, how
uh,
did you feel regarding this session? This is the first session you had with me live like this. Okay.
yeah. This one
How
is
was
my
the
first
session?
session.
And were you scared, or what made you?
Yeah, a
What
little bit, of
benefit?
course.
Uh-huh.
A little bit.
It is real exam like that you feel. Now in the
Yeah,
exam you'll not be afraid. In the exam you'll
yeah,
not be afraid at all. Correct?
absolutely.
Because
Yes,
when you fight with a tiger, you can fight with a cat.
yes,
Correct or not? I am a tiger
yeah,
here, right? Correct or not?
yeah,
So that it will not appear. Simon sir attacked me like a tiger. Now what is there? You are just a cat like that. There you will see tiger only, not a cat. Okay. So
yeah,
imagine the tiger and you can easily handle the cat. Correct? Mhm. Because there he will be smiling. Here I am terrific, right?
yeah.
Yes, come on. Then tell me,
Yeah, I've
what
noted
was your
down
experience?
the
How was it?
It's really very good. I've noted down the notes which you just said for me to be improved, and I'll work on it definitely, and also on passive voice as well.
Yeah,
Yeah, I would say that it's good for me, for especially for me to face like this, to what do you say, like to eliminate the fear of exam.
yeah. So there's a worst factor. There's a worst
Yeah,
factor. Yeah. And what more did you learn?
a lot more. I don't know how, like I don't know how to specify, but yes, I have learned a lot from this platform.
Yeah. So that's all for today.
Yeah.
Mm, yeah. And then remove it. Yeah. So, all right, this is from Grandmaster class, and wait for more turns like these sessions, and you'll enjoy a lot. I assure you, that's a difference. Training, training with a difference. It's not the same. It's always expected something different. Always expect the extraordinary, not the mediocre from Grandmaster class.